In the name of Allah, the most gracious, the most merciful, I want to talk about type 1 diabetes mellitus. The type of this diabetes is affecting children usually. And I hope this work is ongoing charity for the sake of God. Causes of type 1 diabetes usually due to insulin deficiency. Insulin deficiency due to destruction of the insulin producing pancreatic beta cells, and mostly this is due to viral infection, and it is something like autoimmune. It can be prevented. Can we prevent this type 1 diabetes? Anything the family can do so it can prevent it? No, it cannot be. Can it be prevented? No, we cannot prevent it. Is the family is the cause for the child getting this diabetes? No, nothing causes this diabetes for the child. It is something coming from God. Unfortunately, it is a lifelong condition, and so we need to understand it well to avoid the complication. Symptoms of type 1 diabetes usually will have child coming with polyuria, polydipsia, and also he have loss of weight. Although family will tell you he's eating more better than before. He is eating more better. He have improved in his appetite. He's eating better. Sometimes also it can come with nausea, vomiting, abdominal pain, and rapid breathing. This is symptoms of type 1 diabetes. For this polyuria, the family can tell you sometimes the child is well controlled. He's not passing urine in his bed, but nowadays he have like enuresis. He's passing urine frequently. How we can diagnose type 1 diabetes? Diagnosis of type 1 diabetes. It is we have two ways. Either we will check random blood glucose, and the random glucose, it will be equal or more than 200 milligram per deciliter. And fasting glucose will be more or equal to 126 milligram per deciliter, which equal to 7 millimole per liter. Other things we can measure to diagnose type 1 diabetes is glycosylated hemoglobin A1C. If it is more or equal to 6.5, this means there is the increase in blood glucose for the last 10 to 12 weeks before the time of the measurement of blood glucose. Okay, as we said, for diagnosis we have random blood glucose more than 200 milligram per deciliter, or fasting blood glucose more than 126 milligram per deciliter, which equals 7 millimole per liter, or hemoglobin A1C more than 6.5, which indicate average blood glucose in 10 to 12 weeks before the time of measurement. Is it important to know when the diabetes started? Because some families they are asking, did he have this diabetes for the last 1 month? Is it for the last 2 months? Is it just now for the last 1 week? It matters nothing. It have no benefit to know if it started 1 month, 2 months, 3 months. It have no meaning in the management for the child. Okay. Management of type 1 diabetes. Usually, we're admitting the child who came with first time, newly discovered type 1 diabetes, and the aim from this admission is educate the family in how to check the blood glucose for education, how to monitor glucose, and we have for monitoring of glucose, we have two different ways, by serum or by blood, direct blood, or by sensor. Which is better? Better we check it by blood. By blood is more important. Sensor, it will give you not the real, but near to the near reading of blood glucose. Okay. Second thing, also the aim from admission here is to teach the family how to give insulin. The teaching will be by the nurses, by diabetic educators, by doctors. They will teach you how to give insulin and how to rotate side of insulin, insulin. So the second cause of admission, how is insulin, teaching about insulin administration. Okay. The third cause of admission, teaching about proper healthy diet. Healthy diabetic diet. Teach about healthy diabetic diet. Healthy diabetic diet. The fourth, and this is very important for us, the family how to know how to adjust insulin dose according to blood glucose level. How to adjust insulin doses. Okay, and this is a very important point for us. Usually it is in the start it's difficult for the family to give insulin. They're feeling this is very painful for the child, but really it is needed to give it to avoid the complication. Because simply all food we're eating will be transferred to glucose. This glucose needed in all cells, need to enter in all cells. Otherwise the cells will stop working, all cells except the brain. If the cells did not find this glucose, it can die, it cannot work properly. And for this glucose to enter inside the cells, it needs a key. And this key is the insulin. And if the child is lacking this insulin because of destruction, or to the destruction of the beta cells of the pancreas, he have deficiency of insulin, he will not have glucose inside his cells. So this is why we have to replace and to give him insulin. We have different types of insulin. There are different types of insulin, and we have different regimen of insulin. But as studies shown, the best type of insulin given for the children is the long-acting insulin, long-acting, like mellitus. It is a gray color, given once per day. Like if given, like if we give, like for the child, if we give him first time at 3 p.m. or 6 p.m. or 5 p.m. whatever the time, it have to be in this time. We can adjust the timing by making it more near by 1 or 2 hours. We can make little different in the timing, but it should be once per day and better to be in fixed time. Mellitus insulin, this is it controls the glucose. It can control glucose for 20 to 24 hours. For example, if the doctor decided the dose of Lantus to be 8 units, is this 8 units will be fixed? No, it will not be fixed. 8 units, it can increase, become 9, and it increase, become 10, it can increase more. And it can be decreased to 7, and also it can be decreased to 6, and it can be decreased to 5. And this is according to blood glucose level, according to glucose level at early morning, or when child awake from sleep, or when child awake from sleep, according to glucose level at early morning, or when child awake from sleep. Okay, and the ideal to find the blood glucose between 80 to 140 when the child awake from sleep. If the glucose below 80, we have to decrease the insulin immediately. So it is from 8, it will become 7. And if we are already in 7, it will become 6. We have to decrease it by 1. Okay? And if glucose more than 140 for 2 to 3 days, no need to increase the dose immediately. For 2 to 3 days, it remained above 140. We have to increase the dose. From 8, it will become 9. Then again for 2 days, it will become high. I can increase it again by 1. Usually for decreasing, we'll decrease immediately for decreasing. But if for increasing, we can wait for 2 to 3 days. And as we said, it will be given only once per day. This is the first type of insulin, the long acting. The other one is the short acting, and as I said, this is the best regimen we are using for type 1 diabetes. Short acting, we have Novorapid. It is orange color, Novorapid orange. It is given pre-meal, breakfast, lunch, and dinner. Pre-meal. Okay, and also this will depend, we can change the dose, like if your child decided for him 2 units Novorapid pre-meals, this is 2 units can become 3, and it can become 4, and it can become 1, and it can become 0, not receive insulin. According to what? According to the reading, pre-meal, or 2 to 3 hours, according to reading, pre-meal, or 2 to 3 hours pre-meal, or 2 to 3 hours post-meal. Ideal to have the blood glucose reading between 80 to 180. If it is below 80, we have to decrease the Novorapid from 2 to 1. We have to decrease immediately next time. But we have to be sure that the child eat properly, not because that he receives the injection and he did not eat. If the child eat properly, and after that his blood glucose decreased below 80, so we have to decrease the dose, next dose. If it is in the breakfast or in the lunch time, we have to decrease it. From 2, it will become 1. If the reading for like 2 times above 100, 2-3 times above 180, I have to increase the dose of novorapid, the orange one, the short acting and rapid acting. It is a short acting and rapid, short and rapid acting. So I have to make it from 2 to 3. And if already I am in 3, I have to decrease it, to increase it to 4. The third point we want to talk about is the hypoglycemia. What is the meaning of hypoglycemia for diabetic child? This means blood glucose below 80. Below 80. Okay? What are you going to do if the child blood glucose below 80? Give juice around 100 ml. When to check the blood glucose after that? After 15 minutes. After 15 minutes, check glucose. If it's still below 80, again you will give second juice till it is above. 4 things you are going to do. You will decrease the responsible dose, the cause of this hypoglycemia. If you have this hypoglycemia in the morning, so you have to decrease the lantus. If this hypoglycemia, blood glucose below 80, post meals, this means the dose for the meal was high, so you have to decrease it. So you have to decrease responsible dose. You have to decrease the responsible dose. Okay, this is what we are talking about. Okay. Sometimes we need to give a correction. What's the meaning of correction? Correction means if I found the blood glucose, like for the child, high. Correction, if the blood glucose high above 400, if I found the blood glucose high above 400, correction, as I said, for correction, if glucose high, correction, above 400, I can give 1 unit of novorapid, the orange, novorapid, orange one, the short and fast working, 1 unit correction. If it is pre-meal, I found the reading is 400. Instead of giving him 2 units, I will give him 3 units. And if this one happened, but there is no meal, still I can give him 2 units as a correction. Okay, this is for now. And inshallah, we'll talk in other videos about other regimen and other types of insulin, and we'll talk about the proper food for the diabetic patient, and we'll talk about the honeymoon period for diabetic, and we'll talk about if the child can be cured from diabetes. Thank you, and I hope everyone will be well, inshallah. Thank you.